the other issue is that the framework of European biological medicine, there's something called homotoxicology, which is the study of how toxins are affecting disease. So we can trace any toxin in any compartment in the body and see how, as we go deeper and deeper and higher level toxicities, we can see the degeneration that happens. And this is a concept that's foundational in European biological medicine. It's a concept that's foundational in these clinics in Europe that use drainage. They understand that the toxins, that eventually the toxic load becomes to the point your body's trying to store it. You're getting all these exposures, your body's trying to store it. What does it do? It puts it into fat and it puts it into the extracellular matrix. The extracellular matrix is a space that lives throughout the body. It's about 20% in terms of space of the body. Every cell of the body touches that space. The lymphatic system touches that space and drains that space. That space is where we store a lot of toxicity. When there's an increasing toxic load, what happens is toxins eventually they get driven inside of cells. The body tries to hide it, but eventually they can't hide it as much. And so that eventually it goes inside of cells. Inside of cells, there's a few things that happen. It can get hidden and stored inside the cell, or it can drive deeper into the nucleus and start affecting genetic variations within the cells. And so you get this progressive degeneration of the cell that happens with increasing toxic load, which eventually the most degeneration is cancer. Cancer is when the DNA of the cell, the nucleus has become has transformed to the point it can no longer replicate properly, and you get the creation of cancer cells. But all along that way, in homotoxicology, we see how there's a development of autoimmune disease potentially, how there's a development of heart disease, of all these things that toxic load contributes to. And so in European biological medicine, it is one of the primary, if not the most primary, root causes of dysfunction, because we know it to study it this way. And you see, as we start detoxifying, what happens is inflammation is a phase along the homotoxicology scale. Inflammation is in the beginning phases. And so once we get out of deep storage, or when we've had toxicity for a long time, we move through that initial the first or second phase where there's inflammation that happens. We get through that. Then we're on the other side where we have a healthy extracellular matrix, healthy cells, and we have complete actual healing that happens. And so the study of homotoxicology is something that really isn't known about or done in the United States, especially not functional medicine practitioners, whereas it's very, very common in the US, especially for practitioners who utilize HEAL, which is the company, Dr. Rekawek, who created the homotoxicology scale. HEAL is the company we utilize for our more advanced drainage in the clinic that we can't use with patients who are not, getting intravenous IVs of these really intense, really powerful IV drainage remedies through a company like HEAL that produces those remedies